Hi everyone, Dr. David Kulla here with Synergy Wellness in New York City. For those of you that don't know, I do specialize in costochondritis. I see hundreds of cases a week, some of the most severe cases, okay? We've got a whole playlist of videos. If you suffer from costochondritis, please check that out. There's everything from tips to stretches to magic bullets, but this video is about the 4 phases of costochondritis care. And a lot of doctors just don't know how to treat this. They may claim they do, but they don't. And there's really, the 4 phases, we're gonna break it down, and you cannot do phase 4 before 3 or 2 before 1 or no. Phase 1, 2, 3, 4 in order, in that order is really important. Otherwise, you're gonna get worse. You're not gonna get through this. So please just follow this. Number 1, phase 1, get that inflammation down. How do you get the inflammation down? There's really 2 ways. 1, the best way, hands down, cold laser therapy. Stop messing around. That is the best way. But not everybody has access to a doctor that has cold laser therapy. And I've done videos on what kind of lasers, and I'm telling you right now, the cheap lasers you see on Amazon and stuff are not going to get deep enough to penetrate through the chest wall and really get that inflammation down, especially for severe cases. Might help a little bit, but you need a deep laser, okay? So go into a chiropractor that knows what they're doing with that. The other way is ibuprofen, Advil, Tylenol. Well, Tylenol doesn't reduce inflammation, it just reduces pain. So if you want to do non-steroidal anti-inflammatories like ibuprofen or naproxen over the counter, do that for 2 weeks only. If it hasn't gotten better, go and do cold laser therapy. Now, inflammation, you got to get the inflammation down. Phase 1 is the first thing, and you got to get it completely down, and that can take a few weeks for some people in severe cases. Laser speeds that process up 40 to 50% faster. Then phase 2. Guess what phase 2 is? No, not exercising. If you exercise at phase 2, you're going to relapse all over again. Phase 2 is stretching, right? I've done plenty of videos on stretches for costochondritis. Check those videos out. I'm not going to put them in this video, but I have a great video with 3 of my favorite stretches. Focus on those. Make it simple, people. You can start the stretches phase 2 at the end of phase 1 after the pain is gone, the inflammation is gone. Then you can start stretching the muscles, not exercising, stretching. That's phase 2. Okay, then after phase 2, after you've really stretched the muscles really good for 2 to 4 weeks, now you're 8 weeks into the treatment, right? 2 to 4 weeks in from stretching. Now you have to start working on the mobility, thoracic mobility, which includes rib mobility and loosening up the thoracic spine. So using the lacrosse ball in between the shoulder blades, using the foam roller. Again, those stretches are in my favorite costochondritis stretches. So do those, right? Increase that mobility in the thoracic spine. Work on either the scoliosis or the kyphosis, the forward bent over curve, okay, or posture. That's now, you've done the inflammation, you've now stretched phase 2. Phase 3, thoracic mobility. That takes a few weeks too. And then phase 4, last but not least, strengthening, not the chest. Costochondritis is an overuse injury. Don't strengthen the chest. Strengthen the posterior chain, the back. Posterior chain is what you want to focus on, and don't do that too soon. If you do phase 4, which everybody does this, they do phase 4 at the end of phase 1 or halfway through phase 1, or they start with phase 4. No, you're going to aggravate things and flare it right up. Thank you for tuning in. If you guys have any questions or comments, we probably did a video on it. Check out the costochondritis playlist. Hit that thumbs up button and don't forget to smash that subscribe button. 4 new videos out every week. Thank you. God bless.